Thank you for the introduction. My name is Jeanine van Klink. I'm a psychologist, a child psychologist, and a researcher. I'm interested in the long-term outcome of complicated monochorionic twin pregnancies. And I initiated this study with Lisanne Tollenaar, also a researcher, and she has great interest in the spontaneous steps. And I also have to admit, these beautiful slides I'm going to show, these are made by Lisanne and not mine. So a little confession. What do we know? Post-laser taps, we initiated a study in 2014. Femke Slaghekke and I, we looked into the long-term outcome of post-laser taps children, and this was comparable to twins treated with laser for taps. But the spontaneous taps outcomes, we did not know. So in 2019, Lisanne and I started a long-term follow-up study in the post-laser, in the spontaneous taps groups, and I will show you what we did. So between 2005 and 2017, we detected all spontaneous taps pregnancies from the Netherlands, and we asked them to come to the LMC for a developmental test. So the LMC is the National Referral Center for monochorionic twin pregnancies. So parents had to come with their children from all over the Netherlands. And what we did a neurological test and a cognitive test, but we also looked at their fine and gross motor development with standardized psychometric tests. It's 2 years. The Bailey scales from 3 to 6 years, Wechsler scales, Wechsler preschool and primary scale of intelligence, and from 7 years to 16 years, the Wechsler intelligence scale for children. And also we asked parents to fill in a child behavior checklist to assess behavioral problems, socio-emotional problems, but also an open-ended questions about their main concern about the development of their children. So the main outcome of our study was neurodevelopmental impairment, and this is a composite outcome. It contains cognition, motor, but also hearing, vision, and cerebral palsy. And we subdivided neurodevelopmental outcome into 2 grades of severity, mild, moderate, and severe NDI. Our results, well, between 2005 and 2017, 49 spontaneous taps pregnancies were detected with 98 fetuses, and perinatal mortality occurred in 15 fetuses and 2 neonates. So 81 children were eligible for follow-up, and unfortunately 9% was lost to follow-up, but we did test 74 children at a median age of 4 years. And that included 34 donors, 40 recipients from 41 TAPS pregnancies. So these are the short-term outcomes for this group, for the 74 children. Almost 60% had a fetal therapy and an antenatal diagnosis. Gestational age at birth for the pregnancies was 33 weeks. And we do see already a large discrepancy between birth weights. And 71% of donors were also small gestational age. There were no differences between severe neonatal morbidity for these children. So the long-term neurodevelopmental outcome. In total, 30% had an overall neurodevelopmental impairment. And the donors were much more affected than their recipients. And this finding was new for us because in TTTS twins, donors and recipients are equally affected. Severe NDI occurred in 9%, and overall a total score is comparable to the TTTS populations. But when we look at the donors and recipients, we see 80% of the donors were affected and only 3% of the recipients. Mild to moderate NDI was present in 20%. 26% of the donors and 15% of the recipients. Well, the median score of the donors was also lower. Cognition was 95 in donors and 101 in recipients. And this was also a significant difference. Donors much often had a lower IQ score, an IQ below 85 or an IQ below 70. And a striking finding was the bilateral deafness. Enrico already told about it. 15% of the TAPS donors was deaf and none of the recipients were affected. And this deafness was based on auditory neuropathy. And if we want to compare it with another group of children born premature or on the NICU, those are only 1% against the 15% of TAPS donors. So a striking finding. Overall, the donors were at a 4-fold higher risk of impairment, and this is mainly due to a cognitive delay and bilateral deafness. We also looked at behavior. If we look at the total problems, this wasn't different, very much different than the normal Dutch population, 10%. 9% for the donors, 10% for the recipients. But if we look at what parents have to say about their concerns in the open-ended questions, then we see that 61% of the parents had concerns about their donor development and 33% of their recipient development. So it wasn't in the numbers, but more in what parents actually had to say and what they experience in daily life with their donors and recipient twins. We also did a risk factor analysis, and gestational age at birth was independently related to NDI. So each week of gestation decreased the risk of NDI with 30%. Also, severe fetal anemia was independently related to the risk of NDI. It gave a 6.4-fold increased risk of NDI.
Dr. Levy, one of the questions that comes up in the group is actually what constitutes severe fetal anemia? Like, what's the level? That's one of the questions that we quite often get asked, and it's kind of like a for us. So,
yes, yeah. Well, maybe Enrico, severe fetal anemia. I think when we talk about a 2, that's severe.
Yes. Well, there are thresholds for what we call mild or severe, and they can plot it, and they can see when it's they can measure the velocities of the blood, and then they have some nice graphs, and they can see if a baby is very anemic, then the blood goes very quick, and then it's highly increased, and that's a sign of severe anemia.
Okay.
So the more severe fetal anemia increases the risk of a neurodevelopmental impairment. So in conclusion, when we talk about long-term follow-up, TAPS is not a mild disease. Overall NDI is relatively high. And TAPS donors have a 4-fold higher risk of that NDI, with an unexpected high risk of bilateral deafness, higher rate of mild cognitive delay, lower cognitive scores, and more parental concerns. 61% of the parents was concerned about the development of their donor twin. And again, the risk factors, gestational age at birth and fetal anemia. What I would recommend is a routine long-term follow-up, not only after fetal treatment, but for all spontaneous TAPS cases. And then you have to look at the cognition, hearing, vision, but also motor function is very important. And of course, screening for hearing loss already at birth, because you can avoid a lot of delay when you know there is deafness at an early age. And of course, we are very curious, so we want to do more research into this discrepancy between the donor and recipient outcomes, and about the pathogenesis behind deafness. Maybe we can use fetal neonatal MRI to give more insight into that. And to reliably detect risk factors, also again, step stage or severity of fetal anemia, we have to have large groups of TAP survivors. And so we need multi-center national, international collaboration to do that research. So here you have an infant with the right test, automated auditory brainstem response. It's a mouthful. And here is our dedicated research team. So I have to emphasize optimal care for twins is teamwork. That goes from the patients, the fathers, the mothers, to the neonatologist, the fetal therapist, to a psychologist to do the long-term follow-up, but also the pediatrician and of course our research team. And a special thanks to all the children and the parents who participated in our study.